Standardizing psychiatric care, a model for diagnosis and treatment of major psychiatric disorders, video 4 of 4, namely Voices and Stories of Patients, Future of Psychiatry, and Literature Consulting. Video 4, this contains voices from my office, namely stories of patients and very important voices what they shared with me, and I call my office the lab. This is my new lab where I conduct dry experiments. There's a wet lab and there's a dry lab. So I call my current profession being in a dry lab. And then the stories of patients are followed after that. Then there are more stories of patients, then future of psychiatry, literature consulted, and the acknowledgements. Experiences of patients with mental illness in their own words. There are some things we just don't talk about. These are family secrets. For example, my father changed his name to Linden from Lieberman when he came from Germany to America. He did not want to know that he was Jew and German under the coat. Next quotation. I began working in massage parlors at the age of 18 and then a nude modeling agency. They were just covers for prostitution. It was about 5 months until it was obvious I was pregnant and had to quit. Most of the time I spaced out pretending my physical body was doing this, but I was not. End of the quote. Quote, between the ages of 17 to 25, I was extremely promiscuous and abused drugs. During this time, I gave birth to 2 daughters who were adopted. Quote, my 1-year older brother, who was twice my size, started raping me from the age of 13 to 15 until I left home. It was the same every night. I cried, I bled, I hurt. It ended with, I'll kill you if you say anything to anyone, and I shall tell mom and dad you have been doing the same to me. End of the quote. I found my mother dead by hanging herself in the attic. I was horrified. I called 911. Quote, I found my husband dead in garage of carbon monoxide poisoning. As a physician, I could not help. It was too late. He was hospitalized previously 3 times, and last time he admitted himself to psychiatric hospital. He was a brilliant scientist and physician and a very well respected Christian. End of the quote. I did not feel safe. I called the police. They checked the house and found nothing out of the ordinary. I believed there was someone else in the house and my things are being shifted around. I noticed footprints outside the house. I noticed people changing numbers on my computer. I was getting calls from people that I did not know. End of the quote. Quote, I make $3,050 an hour in my business of land development. I pay $15,000 per person per month to my ex-wife as alimony. I live with a girlfriend I don't trust and love her. We both drink every night until drunk. I have a lot of money, but I am so unhappy. Sometimes I wish to kill myself. End of the quote. Quote, my 10-year-old son Frankie washes his hands at least 20 times a day. He prays a lot, sometimes 100 times a day. He feels very guilty if he breaks any rules at home. He is a very good student and makes all A's. End of the quote. I have been obsessed in making detailed notes and changing clothes at least 5 times a day, even in high school. Most of my life, I felt somebody was watching me. I felt self-conscious of feeling different, thinking different, and being unique from others. I am afraid of crowds, people, and being trapped in elevators. End of the crowd. My father is a dentist He had his office in the house. My mother has been chronically sick and remained in her room. We had maids and servants who managed the house affairs. My father started abusing me sexually from the age of 8 until I got married in Madras, India, and came to the United States. He used to have me masturbate almost every day in his office when all patients were gone. This has messed me up. I can't make love to my husband. End of the quote. Quote, when my wife of 20 years of marriage told me she was no more in love with me, I was heartbroken and went into deep depression. She did not want to go for counseling. I felt a failure, ashamed and withdrawn, as if somebody has thrown a bomb at me. No one in my family had ever divorced. Finally, a psychiatrist friend told me to tell my immediate family what was going on, and the process of healing began gradually. End of the quote. Quote, my mother is a 78-year-old and I am 45-year-old with 3 children. She went to Queen's College in late 40s. She used to throw away and break china and give away family possessions. She used to talk to God and stated to have intimate relations with Him. My father used to be so patient. He took her to all the best places in the country for treatment. Finally, my younger sister, when she was in medical school in late 70s, diagnosed mother being manic depressive, and thus proper treatment started. She has been hospitalized numerous times. Now my sister is a child psychiatrist and I am having strange thoughts that I can't explain. End of the quote. Quote, I was born in Vietnam where my mother worked as a prostitute. I don't know my father. I was sent to USA at an early age to live with my aunt. I was quite promiscuous in school and was sent to a convent. On my 11th birthday, my grandfather came as usual to take me out. He bought clothes, toys and nice food. He started touching my private parts and asked me to play with his penis. He told me this was our secret. I did not tell anyone. He used to pick me up on weekends and take me to isolated places to have oral sex with him. End of the quote. My parents are well-respected academic professors at Medical University in Chandigarh, India, and I am doing my PhD in pharmacology at the University of North Carolina at Chapel Hill in the United States. I'm falling in love with a married Muslim man. My brother is married to a white American woman and he hates me. I work in the lab. I am drawn to potassium cyanide bottle to commit suicide. End of the quote. Stories of patients. In my book, Solving Psychiatric Puzzles, which was published in 2004, I documented, with their consent, stories of patients. They wrote their own life history while I wrote their session-by-session progress of treatment. I also described 18 more stories of patients and their sessions. Details about this book and my research publications can be found on www.solvingpsychiatricpuzzles.com. In this video, I shall share stories of more patients. These are in an abbreviated form with major focus on their medications. I have selected these stories so as to convince my colleagues and other prescribing clinicians that patients with psychiatric disorders can be treated successfully like any other clinical illness. The identities of patients in these stories have been disguised so as to protect their privacy. However, clinical information has not been compromised. MARYLIN. MARYLIN is a 66-year-old, petite, very attractive white female who was referred by her retiring psychiatrist. She has been taking lithium carbonate 300 mg twice daily for 30 years, lorazepam 1 mg daily for 15 years, and trazodone 50 milligrams at night on as-needed basis for 30 years. She is 5 feet tall and weighs 100 pounds. Her normal weight is 110 pounds. She lost 10 pounds due to recent colon surgery. She described history of anxiety attacks starting at the age of 20, initially lasting for a few minutes and later for days and all the time. She had no history of psychiatric hospitalization. She describes herself very neat and clean and putting everything in perfect order, but not obsessive about it. She denies any manic symptoms and denies any bad tempers. She also denied any history of alcohol or drug abuse. She has a history of breast cancer and underwent mastectomy. She has hypertension for which she takes medications. MARYLIN's grandmother had some depression and obsessive compulsive symptoms. She has a brother who retired as oncologist and a sister who is a teacher. MARYLIN has college education, married for 40 years, and have 2 adopted children who are in their 30s and a grandson. She worked with her husband in the real estate business and they are happy and well off. Based upon the information, my diagnosis was generalized anxiety disorder. I got the lithium blood level done, 0.4 milliequivalents per liter, before I reduced it slowly and substituted Ativan with clonazepam, 0.5 milligram BID and mirtazapine at night time. By going off of lithium, there was no change. She started to eat better. She felt more normal and more active. Mentally, she felt like a different person and was able to read a book. She also read my book, Solving Psychiatric Puzzles, and understood better what I was trying to accomplish. She stopped mirtazapine as it was making her agitated and restless and went back to trazodone for sleep on as-needed basis. She continued on clonazepam 0.5 milligram twice daily. On her 3rd visit, she brought the following write-up for me. Quote, I went to Dr. Sethi with much anxiety and doubt. I had been going to one doctor for many years, a female. I have always tried to choose female professionals, not because I am an avid activist, but because I am a female. While riding with my husband to Charlotte, I was also dealing with old familiar feelings of self-doubt, a strange uneasiness, anxiety and a depression while still in the car, and wondered why everyone else has their feet on the ground and calmly going through the day except me. I wondered why, as hard as I tried, I could just simply not make these feelings disappear. Now at the office, I see Dr. Sethi for the first time. He looked a bit like a hippie, but that was okay. I used to be one. It must have been his ponytail. After we met, I settled down and felt more comfortable with him, still not used to a him as my doctor. He of course asked me the pertinent questions and I answered as honestly as possible. We discussed medications. Mine was changed. The anti-anxiety medication has been a great help to me, and I had a bit of difficulty with the antidepressant. It made me restless as I went back to trazodone. I am going to my appointment tomorrow, a lot more relaxed, with a lot less fear of being out of control and with confidence in my doctor. At this moment, I don't feel as if I am fighting myself all the time, trying to make me right. Indeed, I look forward to seeing Dr. Sethi. End of the quote. I was very pleased with her writing. MARYLIN continued to make progress. She plays golf with her husband and enjoys walking and feels her old self is coming back. She started writing poetry and brought one of her poems for me. She continues to deal with her own old age as well as of her relatives and children and husband. She feels happy and free of anxiety. I see MARYLIN every 3 months, and it's a delight to see how well she is doing, taking care of herself and others. It is important to note how lithium carbonate, 300 milligrams BID, and Ativan 1 milligram daily kept her not well for almost 30 years of her life, and these were prescribed by a psychiatrist. Jay is a 50-year-old, 6 feet tall, handsome, well-built, well-nourished, dressed in professional clothes and pleasant personality, weighing 180 pounds. He is married with 4 children and is plant manager of a manufacturing facility with over 500 employees for over 20 years. He has an MBA degree. His condition of panic attacks and anxiety started worsening 4 weeks prior to his visit to my office, as he was working 70 hours a week. He is being treated with sertraline 150 milligrams daily, along with clonazepam 0.5 milligrams on as-needed basis by his primary care physician, and has been placed on medical leave so as to see a psychiatrist as soon as possible. Jay has been to emergency room twice, and his insurance company denied his admission to a psychiatric hospital, as he was not suicidal. Finally, in desperation, he spoke to his church minister, who knew me, and requested for an urgent visit. Jay has a history of depression in his teens, but did not seek any help. At age 36, he had a panic attack and was checked by cardiologists. All his tests were negative, and his primary care gave a prescription of lorazepam that helped. He continued to have panic attacks, especially when he was under a lot of stress, and was treated with alprazolam and buspirone. On his first session with his wife in my office, he described being very depressed, no appetite, and lost 30 pounds in 4 weeks, not sleeping, having panic attacks during day and at night, feeling very anxious and nervous, having a lot of negative thoughts of being a failure, and at times feeling better dead than alive. He absolutely denies any suicidal thoughts or plans, as he loves his family. Based upon his presentation, I gave Jay a formal diagnosis of generalized anxiety disorder, panic disorder without agoraphobia, and major depressive disorder. I gradually stopped sertraline and started on fluoxetine, mirtazapine, and kept clonazepam on PRN basis. On his next visit in 10 days, Jay reported feeling much better. He was sleeping better, and his appetite also improved and better, and gained 4 pounds. His depression and anxiety were also improving, and he started to feel hopeful and having no negative thoughts. He was also very eager to go back to work. In view of his improvement, I gave him a note to go back to work in 7 to 10 days, initially part-time for 1 to 2 weeks. Before going full-time, I gave him an appointment in 2 weeks. Jay's part-time job was not stressful, and he was taking fluoxetine 20 milligrams daily and mirtazapine and clonazepam as needed basis. He was eager to go back full-time. He had gained 20 pounds and started jogging, swimming, and exercising with his wife. Jay continued to follow in my office, initially once a month, then once in 2 to 3 months. He continued to make satisfactory progress and wishes he would have come to my office several years ago in his 30s. John. John is a 37-year-old, 6 feet 2 inch tall, good-looking, athletic, African-American male, driven by his wife to my office with a lot of anxiety and panic attacks. He was referred by his therapist and was taking buspirone 5 milligrams twice daily for 2 months. He has a history of drinking alcohol heavily, and currently he drinks 6 to 18 beers every day, 4 to 5 times a week. Also chews tobacco for the past 15 years. John describes history of anxiety and panic attacks all his life, and has been treated by his primary care physician with sertraline, paroxetine, citalopram, buspirone, bupropion, venlafaxine, desvenlafaxine, and alprazolam for the past 3 years. His symptoms include panic, depression, dizziness, but no suicidal thoughts. John has a severe history of anxiety and alcoholism on both sides of his family. He is the only child, and his parents divorced when he was 17 years old. John has a 4-year college degree and played baseball for college and was drafted for professional baseball team, but only for 3 weeks. He worked for a national beer company for 4 years in sales and has been married for a year, and his wife has a very good job. Currently, he is not working for a year. His unemployment benefits are running out, and he is looking for permanent disability due to his inability to drive and getting panic attacks. I started John on fluoxetine, naltrexone, and hydroxyzine and asked him to go off of buspirone and reduce alcohol and nicotine and go to AA meetings. Within 2 to 3 weeks, he stopped drinking beer and reduced dipping, and according to his wife, became more hopeful, getting along better, doing more chores at home, and smiling and laughing more. John was exercising regularly on treadmill and sleeping better. However, he remained very anxious and unable to go outside the house and drive. In addition to other medications, I also prescribed clonazepam 0.5 milligram twice daily on as-needed basis. John started to make progress of driving small distances, going to grocery stores, walking, lifting weights, going out with his wife for dinner to restaurants, playing golf, and even looking for jobs. He had no panic attacks, anxiety, or dizziness. On fluoxetine 20 milligrams, he had reduced sex drive, but no problem with erection or orgasm. Within 3 months of treatment, he got a job as baseball coach, and his wife became pregnant. He went to a wedding and Christmas party with his wife, but did not drink alcohol. John found a better job of making $30 an hour as a baseball coach. Now he travels to different places with his team without any fear. He became father of a baby boy, Charlie. He is very happy with his family, and his parents are moving to this area. Now he has better dreams of opening his own business. John is stable on fluoxetine 20 milligrams, naltrexone 50 milligrams, and clonazepam 0.5 milligram twice daily. He has made huge progress, but chews tobacco as part of baseball culture. He is reluctant to try Shantex. He has also started to do meditation and yoga to help him go further in his life. In John's story, I see wonders of medications and therapy. We are truly in new age of treating psychiatric illnesses successfully. Rita is a 50-year-old married Hispanic female who has a psychiatric diagnosis of bipolar affective disorder and attention deficit disorder, and was treated by a psychiatrist in New Jersey for the past 3 to 4 years with Abilify 20 milligrams, Lamitrogene 150 milligrams, and Vyvanse 70 milligrams, and recently for 4 months with Vibrit 40 milligrams as well. In the past, she has been treated with Prozac, Cymbalta, Zoloft, and Lexapro. She has a family with husband and 4 children, and they moved to Charlotte because of her job, and she was referred by her primary care physician to my office. She described her history of mood swings, of being in manic phase lasting for weeks and then going into deep depression for weeks to months, starting in her late 20s. She was also diagnosed with attention deficit disorder about 3 years ago, when she had difficulty with story of heavy drinking from 16 years old to 43 years old. She has been sober for 7 years. She has a history of bulimia in her 20s and explosive tempers when drunk. Rita started her current physical symptoms of weight gain of 30 pounds in 3 years, increased cholesterol, and being borderline diabetic. Her psychiatric symptoms are being tired all the time, sleeping too much, difficulty remembering, and her Children call her lazy. I explained to Rita that there is no standardization in treatment and diagnosis of psychiatric illnesses, and her current symptoms may be due to side effects of her medications. Therefore, I recommended changes to my choices of medications, and she agreed. I took her off of Abilify and Vibrate gradually and substituted with fluoxetine. I also increased her Lamotrigine to 200 milligrams, and in transition, she went through some withdrawals such as gastrointestinal symptoms, runny nose, headaches, ulcer in her mouth, more anxiety and depression. She stuck to the plan, and within few weeks she started to feel better and slowly started to lose weight. She also had difficulty with her sleep and responded well to trazodone. Finally, I took her off of Vyvanse and substituted with Adderall so that she can adjust it on as needed basis. Rita's new regimen of medications are as follows: Lamotrigine 250 milligrams at night time, fluoxetine 10 milligram, Adderall 10 milligram, and trazodone 25 to 50 milligram. She has lost 20 pounds in 5 months. She is more alert and not lazy. Her mood swings are under control as well. Her tempers. She is performing better at her job, and her relationship with her children and husband are improving. I am sure at her next blood work, her cholesterol and blood sugar are getting under control. Further, Rita is very happy in saving a lot of money on her co-pays for expensive brand name medications. Do no harm is the most important oath of a doctor. We should ask an important question: are we working for big pharma or in the best interest of our patient? Susan. Susan is a 44-year-old, 5 feet 5 inch tall, 150 pound, attractive white married female. She has been taking citalopram 20 milligrams daily for a year, along with clonazepam 0.5 milligrams on as needed basis for sleep from her primary care physician. She felt weird on citalopram and stopped. At her first visit, she described her symptoms as having learning disability from her childhood, unable to focus, difficulty concentration, mind wandering, distracted easily, and unable to finish tasks. She takes clonazepam on as needed basis for mild anxiety. She has also other psychiatric symptoms and denies use of alcohol or drugs. Susan was adopted at 8 months. She does not know her biological parents, and her biological her adopted parents are in their 70s, and they are well off. She was born in Richmond, Virginia, and family moved to Charlotte when she was 10 years old. She described sexual abuse by her babysitters from the age of 6 to 10. Thereafter, she was sexually abused by others, and she started using drugs in her teens. She also tried to run away several times and also went on dates and escort services. There were obvious conflicts at home and with her parents. She went to, at age 18, she started hitchhiking in search of her biological mother and found truckers. She went to Chicago, Memphis, and finally ended up with Richard Turner, 6 feet 6 inch tall, weighing 300 pounds, a trucker in Maud, Oklahoma. He kept her prisoner and abused her physically, mentally, and sexually. He took her to rural Lincoln, California. He abuse continued, and finally Susan killed Turner with his gun. She was convicted of murder and sentenced for 19 years in prison. 4 years after Susan's conviction, State of California passed a law, and she hired a lawyer, and in the new trial, Susan was freed, and she went back in 2005 to her adopted parents in Charlotte, North Carolina. Susan's story has been made into a documentary entitled Abused by producer MARYLIN Braverman. It has been aired numerous times at arts and entertainment TV stations. Further, Eric Berkowitz wrote her story, Murder or Self-Defense, in an online magazine, What Way, in spring 2006. Susan got married at age 41 to Scott, and they have a 2-year-old son who had skull injury during birth and needs a lot of physical attention. Susan has good connections with the local university criminal justice department and gives talks to students and sexual abuse victims. Her major stressors are traumatic history and her son David. She has very good support from her husband, parents, and university professors. Physically, she is healthy and good looking. Based upon the information at hand, I diagnosed Susan with attention deficit disorder, post-traumatic stress disorder, and learning disability. I educated Susan on her diagnosis and my rationale of starting her on dextroamphetamine and explained its side effects. After 3 weeks, I saw Susan and she was taking dextroamphetamine 10 mg twice daily. She described being more focused at home and work and having more energy and mentally being more alert. On her return visit in a month, Susan was thrilled about her progress in such a short time despite her therapy for 2 decades. She had more energy, better focus, learning sign language, giving more talks, and going for a special program at local TV stations. She was going out and being less shy in social settings. She lost 10 pounds and was doing exercise regularly. Susan continued to make progress, and I started seeing her once in 2 months. She handled the anniversary date of killing her abuser on May 5, 1986 well, and was upset for 2 to 3 days. She also organized a big party for her parents' 50th wedding anniversary and felt comfortable with all her friends and relatives. She is also more comfortable in her intimate relations with her husband, and there are rare sexual abuse recall incidents. It is indeed remarkable how a small pill of the right kind can bring huge changes in our thoughts, perception, behavior, confidence, and overall happiness. Carlos. Carlos is the good-looking, 5 feet 9 inch tall, weighing 170 pounds, Hispanic white male. He came to my talks on mental health at the Unitarian Universalist Church of Charlotte, North Carolina, and decided to switch his psychiatric care to my practice. Carlos has a diagnosis of bipolar type 1 with psychotic features. He has been hospitalized several times due to exacerbation of manic symptoms. He has been treated with risperidol, Zyprexa, Geodon, Zoloft, Lexapro, and Wellbutrin. At his first visit in my office, he was taking Lexapro 30 milligrams, Abilify 10 milligrams, and lithium carbonate 1350 milligrams daily. He described his symptoms as low energy, lack of motivation, no libido, not enjoying, feeling slightly depressed, and functioning poorly. On a scale of 1 to 10, 10 being the best, 1 being the worst, Carlos described his functioning at work, home, and social settings at 4, 4, and 4 respectively. He was afraid of being fired from his job due to poor concentration and poor performance, and was ready to submit his resignation. I urged him not to resign from his job. I decreased lithium carbonate to 900 milligrams, Lexapro to 20 milligrams, and started him on Wellbutrin 100 milligrams to be increased to 200 milligrams in a week, and kept Abilify at the same dose. On his return in 2 weeks, Carlos reported that he became very energized at 100 milligrams of Wellbutrin and was afraid of going into manic state and stayed only at 50 milligrams. His overall energy and job performance improved 90%. He felt confident, and his depression started to improve as well. In subsequent visits, I gradually took him off of Lexapro, reduced lithium carbonate to 600 milligrams, kept Abilify 10 milligrams, increased Wellbutrin to 100 milligrams, and started on lamotrigine. At these dosages, his libido and erection improved, and he was functioning optimally at job, home, and social settings, and resumed playing tennis with his son. I continued to see Carlos once in 2 to 3 months. I took him off of lithium and reduced his Abilify to 5 milligrams, increased lamotrigine to 150 milligrams, and Wellbutrin to 300 milligrams. With these dosages, he started exercising more and started to lose weight. Carlos was stable for 7 years until conflicts in the family drove him to have recurrence of mania. He was hospitalized. He was discharged on risperidol 8 milligrams, lithium carbonate 1500 milligrams with a lithium blood level of 1.1 milliequivalent. On these dosages, he had severe side effects and was functioning at 50% of his capacity. Gradually, I changed his medication to the one he has been stable under my care, namely Abilify 10 milligrams and lamotrigine 150 milligrams, lithium carbonate 300 milligrams, and Wellbutrin 200 milligrams. Currently, he is performing to the best of his potential without any side effects. It is important for all physicians to reduce or modify acute care dosing, namely in the hospital, as soon as possible to the maintenance ones where patient can function to their optimal capacity. Sam. Sam is a 55-year-old married Asian male, 5 feet 5 inches tall, weighing 135 pounds. He has been in the United States for 23 years and has a 4-year college degree in electrical engineering. He has a stable job for 20 years with the same company. He has been placed on short-term disability by his primary care physician and referred to see a psychiatrist. He has been taking sertraline 25 milligrams daily for 5 days and hydroxyzine 25 milligrams for sleep. About 5 months ago, he went to the emergency room with symptoms of not sleeping, dizziness, blackouts, increased heart rate, shortness of breath, and being very nervous. He was treated with Ambien, metoprolol, and fluoxetine. Recently, he experienced similar symptoms and was placed on disability. Sam described his current symptoms at his first visit as follows: depressed, crying, scared to be alone, feeling very nervous, not driving, and his doctors have put him on 24-hour Holter monitor. His overall functioning is impaired significantly, and his wife has to take him everywhere. I diagnosed him with generalized anxiety disorder and depressive disorder and continued on sertraline and hydroxyzine and added alprazolam 0.25 milligram half to 1 on as needed basis. Sam did not show up for over a month and was hospitalized to rule out stroke and was given buspirone 15 milligrams 3 times a day. He had symptoms of extreme anxiety with depression and had no desire to live. Although 2 of his children were doctors, I took him off of sertraline, buspirone, and hydroxyzine and started him on fluoxetine 2.5 milligrams for 5 days and then increased to 5 milligrams along with clonazepam 0.5 milligrams 1/8 to 1/4 on as needed basis. Sam's anxiety started to improve and he was not crying, but he had no appetite and started to lose weight. I added mirtazapine 15 milligrams 1/4 to 1/2 at night time. He felt dizzy on waking up and this was decreased to 1/8. Sam's condition continued to improve slowly but gradually as he was taking fluoxetine 10 milligrams 1/4 3 times a day, clonazepam 0.5 milligrams 1/4 on as needed basis during the day. He was taking Chinese medications as well all along and did not tell me. He stopped those on his own as they were expensive and had no benefits. It took almost a month for Sam to gain confidence to drive, go to small social gatherings, and not feel scared of nights. He started to do yoga and small exercises, Further, he had numbness on right side of his body and consulted a neurologist who did MRI and which was negative. I recommended massage and continued to see him every 2 weeks. He did not want to go for therapy. Sam continued to make progress at very small dosages of medications. He had great support from his wife, children, and colleagues at work. His supervisor was very happy to have him back at work job. I continued to see him once a month. It is again remarkable that medications must be titrated to the right dosages, and how right dosages of medications can make a huge difference in one's life. Professor Rudolf. I have known Rudolf, 65-year-old, 6 feet tall, handsome, blue-eyed, blonde hair, distinguished professor of biochemistry since I moved to Charlotte, North Carolina in 1990. He and his wife Ute are from Germany, and we are family friends. I have special affinity for Germans since I spent my formative years in West Germany. Further, my favorite subject in graduate school was biochemistry, and Professor Fyodor Lunin, who got Nobel Prize in 1964, was my examiner, and he gave me grade A and told me that I have a possible mutation as no one in my family had higher academic education. 2 years ago, Rudolf had gone to a scientific meeting with his wife to New York City to present a paper. Suddenly he became confused, very tired, quiet, withdrawn, unable to answer questions promptly. Ute became very concerned and flew back home. They went to their primary care physician, who sent Rudolf to emergency room, and he was admitted to the hospital for 3 days. All tests, including MRI, were negative, except low sodium and vitamin B12. He got B12 injections, and consulting neurologists diagnosed with depression. One of their psychiatrist friend gave Rudolf Lexapro along with low dose of Klonopin due to extreme anxiety symptoms, but he did not want to treat due to family reasons. Rudolf family, however, kept me informed. They consulted another psychiatrist, another neurologist first, who after the neuropsychological testing gave Rudolf daily patches of Exelon and diagnosed with dementia. Rudolf's brother is a physician in Ohio, and he also gave a diagnosis of Alzheimer's dementia. There was no improvement, and he continued to have extreme shakiness, not sleeping, talking to himself, problem with concentration and focus, and not functioning, and the family finally decided to see a psychiatrist after 2 months. The psychiatrist did not accept Medicare, and they had to pay cash. She prescribed nortriptyline 25 milligrams along with Xanax extended release 0.5 milligrams daily. Since there was no improvement even after increasing the dose of nortriptyline to 50 milligram, the psychiatrist added Abilify and increased its dose to 5 milligram and continued to see him on weekly basis for 4 months. Rudolf initially went on disability and finally decided to retire from his job. I was kept informed and remained neutral and non-judgmental. Rudolf's condition was deteriorating, and I felt bad of not being able to help him due to his family hesitation that doctors should not treat their own family members or friends due to confidentiality and other issues. Finally, Ute called in desperation and came to my office with Rudolf. I was shocked to see all the textbook side effects from his medications. I knew from my experience that I shall get him well, and I offered my help on one condition, that he will not be treated, he will be treated in my office, and he must comply with the treatment plan. Rudolf was taking nortriptyline 50 milligrams, Abilify 3 milligrams, and Xanax ER extended release 0.5 milligram daily, and his symptoms on his first visit were as follows: sleeping too much, unable to think clearly and taking a long time to respond to a question, slowing of thinking and body movements, unable to make decisions, not functioning, not reading newspaper, no interest in watching TV, neglecting paying bills, not wanting to socialize, and not playing with grandchildren and isolating himself. Further, his functioning on a scale of 1 to 10, 10 being the best, 1 being the worst, was at home, work and social settings 3, 2 and 2 respectively. On a scale of 1 to 10, having worst and 10 having no symptoms, he described his depression, anxiety, cognition, driving at 3, 5, 4 and 5 respectively. He denied any symptoms of obsessive compulsiveness, bad tempers, mood swings or psychoses. He further denied any suicidal or homicidal thoughts and denied any use of alcohol, nicotine, caffeine or drugs. He has a family history of depression with his mother, father and the doctor brother. On reducing Abilify to 1 milligram and Xanax to 0.25 milligrams, half to 1 on as needed basis, within 10 days, there was a dramatic improvement in being more alert, watching TV, reading newspapers, not sleeping too much, wanting to do more things around the house, wanting to go to YMCA and driving small distances. His mood, however, remained quite depressed. I increased nortriptyline to 60 milligrams and discontinued Abilify and Xanax. RUDOLF continued to make progress in his functioning, but his depression was not completely lifting. And I added bupropion to his medications. His mood and functioning continued to improve. He had some physical problems with treatment of prostate cancer and elevated and blood sugar, and he handled well. Over a period of 4 to 6 months, I took him off of nortriptyline and he continued on bupropion, 100 milligrams twice in the morning and 1 in the afternoon. RUDOLF came back to his normal functioning, going to his office, YMCA, church, social gatherings, attending research meetings, and writing books in collaboration with other professionals. His wife and children were very happy with his progress. He felt as if he has a new life now. He is very friendly, helpful, gracious to his family and friends. Ute is concerned that he is becoming hypomanic. I have reduced his bupropion to 200 milligrams for 3 months, and currently he is taking 100 milligrams on a daily basis for a few months. I monitor his progress once in 2 to 3 months in my office. It is remarkable from this story that we as clinicians have to be very careful in selection and monitoring of medications. We can make patients well and even disabled if not careful. Future of psychiatry. Future of clinical psychiatry is very bright, as most of the common disorders can be successfully treated with medications and counseling. Psychoeducation of patients remain the cornerstone of treatment. Patients must realize the role of genes, environment, stressors, and alcohol and drug use in dealing with mental disorders. Further, healthy food, exercise, yoga and meditation, supportive relationship, spirituality, prayer, and love play a very important role in staying physically and mentally healthy. They also promote resilience and improvement in our immune system. We therefore, as clinicians and therapists, in this process must take more responsibility in standardizing our diagnostic procedures and treatments, and thus making the practice of clinical psychiatry a science. Based upon the material presented in these 4 videos, I have no doubt psychiatry has indeed a very bright future.